engine running.
Absolute genius.
Get this.
Welcome.
This is the show where we bring you
Science.
What that essentially means is
discoveries,
Advances.
questions,
Research.
technology.
Unbelievable.
Without further ado,
This is The Naked Scientists. Hello, welcome to this week's Naked Scientists, the show that brings you the biggest breakthroughs and also talks to the major movers and shakers in the worlds of science, technology and medicine. I'm Chris Smith, and coming up, the impact of the conflict in the Middle East on the region's environmental and human health. Also, scientists find the gene variants that dictate addiction to nicotine, and evidence that Neanderthal men had a penchant for mating with anatomically modern human females. With the Middle East in the midst of widespread conflict, residents in Tehran in Iran have reported what they call black rain falling from the skies above. It's thought that this is the consequence of strikes on Iran's oil facilities, which sent huge plumes of smoke into the atmosphere. Environmental scientists say these particles mix in clouds and can fall back to Earth with the rainfall. Incidents like this highlight the damage to the environment in ways that last long after the fighting stops, and the impact on civilians who often end up breathing in the suspended particles, both from fires, destroyed buildings, and even chemicals from munitions, are often undocumented, but certainly very significant. Doug Weir is the director of the Conflict and Environment Observatory. We asked him for his analysis.
Israel chose to attack 5 oil storage and processing facilities, 4 of them pretty much in close proximity to the city of Tehran and another one down the road in a nearby town. So Tehran is a city of 9 million people. It's very densely populated. One of the other issues we see is that often this thing called the boundary layer, which is kind of like the bottom of the atmosphere, during nighttime in particular, it pushes air down into the city. So when you have pollutants trapped in this bowl in Tehran, you then have the air pushing down on them, keeping them in the city and making sure that people are exposed to poor air quality. So normally that's from traffic and other sources. In the case of these attacks, they took place at night. They were large fires. We see these kind of fires in all conflicts which we look at, and they're very environmentally damaging. Normally you have a hot fire and it pushes the pollutants up out of the city, but because of this boundary layer, because it happened at night, you had a lot more pollution being distributed low to the ground where people were exposed to it. Fumes were a mixture of carbon monoxide, sulfur dioxide, nitrogen oxides and volatile organic compounds, a lot of soot and black carbon, trace metals. And so this mixing with moisture in the air eventually came down as rain, and that was the source of the black particles which you were seeing. But the concentrations, because of the number and intensity of fires and the way in which the setting of Tehran had concentrated them.
So there are a number of threats going on here then. There's what's in the air before it becomes black rain that people can be exposed to. And then there's, once it does rain down, presumably it's on the ground and it's in water.
Yeah, this is it. And I think the other thing to consider is that for days now, Tehran has been intensively bombed by US and Israeli forces. So we'd already seen a large volume of pulverized building materials, weapons residues, all sorts of things, particulate matter chucked up into the atmosphere and also all over Tehran. So yeah, this stuff has been rained out. You see the image of it landing on cars. The rainfall felt acidic, burning to some people. We think this was probably sulfuric acid or nitric acid from mixtures of these gases with water. And this pollution is now on the ground. And that's an issue. So in the summer, this pollution may well be dry and redistributed by the wind as dust. But it also may move from soils down into groundwater around Tehran.
Many of these things, if they're combustion products, we might worry about chemicals that are carcinogenic. So we've presumably got the immediate threat of things like these acid and acidic gases that you've just been mentioning. Carbon monoxide's awful as well. And then we've also got things that can produce a longer term health threat.
Yeah, this is very true. I mean, lots of issues around polycyclic aromatic hydrocarbons. In addition, we've seen a lot of burning, so potentially of furans and dioxins. So yeah, quite unpleasant stuff. I think one of the key problems we have is that we are monitoring these issues remotely a lot of the time. There is very little evidence collected on air quality issues during conflict in urban settings like this, where we see the intensive use of explosive weapons or industrial incidents from burning oil. And to be honest, a lot of the time when these oil sats are hit, they're not located in cities. They tend to be far out in the countryside, so the direct human exposure risks are relatively low. But here we have a city of 9 million people, which makes it quite extraordinary in the history of these kind of events.
What sort of timescale would we expect to see the effects manifest? There's going to be the here and now because the air's full of the stuff, but then longer term, do we have any data to fall back on? Because, of course, there have been other wars in the Gulf. And during the Iraq War, for example, and in Kuwait, there was a lot of oil fires from oil wells that were set ablaze. So do we have any data to fall back on in terms of the legacy effects of this on health and over what period it tends to occur?
It would be incredible if we did. So I guess there's two things to consider. So, I mean, we heard a lot of acute health risk reported by people on social media, people with existing health problems like asthma and the elderly. One thing which was interesting, which came up in our research, was that when you live in a very polluted setting like Tehran, that actually increases your vulnerability to poor air quality events. And it's all very much about the acute. And our issue with conflict pollution and trying to understand the long-term public health effects is that there is a disconnect when we think about health and environment in conflict settings. The focus is always on acute health risks. And when we're thinking about long-term health outcomes like cancer or other effects, often the data just isn't there. The environmental data isn't there. The exposure data isn't there. Populations are often displaced or moved. In many settings, monitoring systems collapse. And I think for endpoints like cancer, you would need to be following a significant population over many, many years to actually determine impacts. So we see this very clear disconnect in pretty much every conflict we look at. And it's something which we really need the health community and the environmental community to come together to start thinking about how we can work around it.
But military organisations do appear to be aware of these sorts of impacts, don't they? Because I remember being a little bit surprised when I first interviewed a chap in America who works for the US Army, and his role as a professional chemist was in trying to develop greener munitions. And I thought that was funny in an ironic sort of way when he first told me, well, we're very worried about the environment, so we're inventing green, environmentally friendly ammunition. And you think, on the one hand, it's designed to do enormous harm, but then on the other hand, people are worried about the stewardship and keeping the environment safe.
So there's a few ways of looking at this. I guess one is militaries aren't going to disappear overnight. So there's a question of, can they be less environmentally damaging in what they do? And when we think about what we do, it's not just about what they do in war. Most of the environmental footprint of militaries is in peacetime. It's during training, it's during manufacturing, it's during disposal of weapons, during all of these other things. And it's this question of, can we reduce this footprint? And when we look at the greenhouse gas emissions from militaries globally, like we've estimated that with colleagues from Scientists for Global Responsibility, to be around 5.5% of global emissions come from military activities. And that's not war fighting emissions.
That's a lot. I mean, did I hear that correctly? 5.5%. I mean, that's close to concrete.
Yeah, 5.5, that's shipping and aviation combined.
What plans are in place, or what plans can be laid to try to clean up the mess that's been made?
I think our concern is that there will be reluctance from whatever comes next in terms of the Iranian regime to be open about the environmental damage caused, to let in people like the United Nations Environment Programme to do assessments on the ground, to actually do the sampling, to actually determine how bad the damage is. And then there's also going to be a lot of reticence from the international community, I suspect, in terms of providing capacity, technical skills, or money to support Iran with post-conflict recovery. So a lot of times in the conflicts that we look at, environmental remediation is extremely expensive. There are a lot of competing priorities post-conflict, and dealing with contaminated soils or sites is rarely one of them. So it may well be the case that a lot of the damage which we're seeing may well last for years, if not decades, and may well go unaddressed in many cases.
It is a very sad state of affairs out there, isn't it? Doug Weir from the Conflict and Environmental Observatory. Gene variants are alternate forms of the same gene. You can think of them as a bit like recipes for the same type of cake, but one which differs in terms of some of its ingredients. Now, some of us inherit one form of a particular gene, while others can have a different one, and this is what we mean when we talk about genetic diversity. And these gene variants can sometimes affect the susceptibility of an individual to certain diseases, or, as it turns out, how heavily they might smoke, as Gonzalo Abacasis from the Regeneron Genetics Center in New York explains.
Our main approach in trying to understand biology and human genetics is to study these experiments of nature. So each one of us has a few changes in DNA that make us unique. And the particular type of change that's very informative is when modify a protein, perhaps by even disabling it. We like to search for examples of these proteins that have a medical consequence or a health consequence because they give us a very clear path for drug development. If we can then develop drugs that mimic these naturally occurring variations, we can then treat disease. In this particular case, we were applying this general approach to study smoking and to understand what makes some people smoke more or less than others.
And specifically, what were you targeting? How were you doing that? Because there are 3 billion letters in the human genetic code, give or take. Did you look at all of them, or were you going for a specific aspect of it?
So our general approach is we try to read every protein coding letter. So the genome, as you said, is about 3 billion letters. About 1% of those letters encode a protein. The rest of the genome is encoding regulation of those proteins. It decides which genes get turned on in which cells and how much of each gene to make. But more fundamentally, the proteins are the ultimate effectors of things. And so we try to sequence every protein and make a catalog of the small variations, which we call missense variations. These are small alterations, one amino acid for another, and also a catalog of all the loss of function variations. These are the ones that maybe introduce an early stop in a protein or another drastic change that completely disables it. Once we do that, build that catalog across all 20,000 proteins of the genome of all the variants they carry, we were relating variations in each protein to the amount of smoking that individuals do.
So you're looking to tie a change to a behavior.
Exactly.
Who have you been looking at? In what sorts of numbers?
In this particular study, we actually started off with a population of about 150,000 individuals in Mexico City. About 40,000 of them were current smokers. And for each of those current smokers, we knew how much they smoke on average. And we were trying to tie variations in individual genes to the amount of smoking that each person does.
And was there a relationship?
Yes, there was. So it was pretty interesting. So, for example, we found that a particular variant in one of the subunits of the nicotine receptors in your brain was associated with a very drastic change in the amount of smoking that people do. So, whereas the average smoker in this set of people smoked about a little bit over 5 cigarettes per day, if you had one of these changes, that went down to about 4 cigarettes per day. And if you had 2 of them, because obviously we each have one chromosome from our moms and one from our dads, then you went down to just a single cigarette per day. And so in our speculation, we think that this is probably pretty key to mediating the how long lasting a reward you get from each cigarette. But the end result was that with this change, your level of smoking went down almost 80%.
Were there, conversely, any individuals where they went from 5 to 10 cigarettes a day?
Not because of this particular change, but sure, there are genetic variants that also can increase your amount of smoking. That was not our focus here, but those do exist out there.
But what do you think the mechanism is? You're speculating perhaps it's the enjoyment or the reward that the nicotine gives the brain. But what is the mechanism for augmenting or reducing, according to which form of the gene you've got, the intake?
What we know so far is the observation. If we change this little piece of your nicotine receptor, you smoke less. Now, based on what's known about how smoking works and what we know about the genetics of smoking, we know that there's a few steps in the process. So for example, there are genes that are involved in propensity for risky behaviors or trying out new things, and those often influence whether you smoke at all versus whether you don't smoke. Now, once you've tried smoking, how much you smoke seems to relate to genes that both regulate how much reward you get from it. If you get a bigger reward, a bigger hit, you might be more prone to smoking more heavily. And there's also genes that regulate how long each hit lasts. Some of these genes mean that the hit you get from nicotine lingers for longer. That also might affect how often you smoke. So we don't know exactly if this is about the hit lingering for longer or a bigger reward. The data we have is not specific enough yet, but we do know the end results, and it's likely to be through one of those two mechanisms.
Does this have implications then for helping people to not smoke? If we understand more about this particular target of nicotine in the brain and how these genes change it in some way, does that give us avenues to explore to help people give up? Because about 75% of smokers say they wish they weren't.
Exactly. So I think one of the things we would like to do is to say, mimic this effect in a drug. Have a drug that gives people who don't have this particular subunit that made you smoke a lot less, have that same benefit. And although that might not help you quit fully, it might take you from smoking those 5 cigarettes a day down to 1, which would already be quite a big health benefit if you could get it.
Gonzalo Abekasis from the Regeneron Genetics Centre there. That study just came out in Nature Communications.
The Naked Scientists podcast is produced in association with Spitfire, cost-effective voice, internet and IP engineering services for UK businesses. Find out how Spitfire can empower your company at spitfire.co.uk.
Music in the programme is sponsored by Epidemic Sound, perfect music for audio and video productions.
This is the Naked Scientist podcast with me, Chris Smith. Still to come, interbreeding between us and Neanderthals. There's evidence that Neanderthal men preferred anatomically modern women. But how do we know? First though, vitiligo is a condition where pale white patches emerge on the skin where the immune system attacks certain groups of cells that produce the pigment melanin. It's not life-threatening, although the white patches are more susceptible to sunburn and therefore skin cancer. But it's also not something that we can currently cure, and the disfiguring effects it can have on people can lead to significant mental health problems. Michael Jackson famously developed the disease but was nevertheless accused of skin bleaching, and the model Winnie Harlow as a child was excluded by other kids because they didn't want to catch her skin problem. So the announcement of the approval of a repigmentation medication called ruxolitinib, which can make the skin regain some of its lost colour, by the NHS marks a huge milestone for the vitiligo community. But how does it work, and why has it only been approved for use now? Victoria Eleftheriadou is a dermatologist and a spokeswoman for the British Association of Dermatologists.
Vitiligo is a skin condition where essentially one develops white patches on the skin. So, for example, if your skin was brown, then it loses its color, what we call pigment. You have these completely white, like milky patches on the skin. The skin is otherwise normal and it can affect any part of your body, but very frequently affects visible areas such as face, hands, neck. So it's very sort of prominent when someone gets it.
And what's the mechanism of the disease? What is going on in the skin to produce that depigmentation?
We all have cells in our skin called melanocytes. So they make melanin, and this melanin gives the color to your skin. So when we do not have melanin, that's when we have white patches. And that is because our own defense system, called immune system, is making the antibodies, and instead of killing viruses and bacteria, they essentially attack the melanocytes.
Apart from the obvious visual impact, which can be presumably very socially stigmatising for people, are there any other consequences, any other health problems that can arise through having this happen in your skin?
Yeah, that's a very good question, Chris. And what sometimes people forget is that the reason we need this melanocyte is to protect us from the sun. So the white patches, because they lack of melanin, they lack color essentially, they are more prone to burn in the sun. So, for example, if someone has vitiligo on face and hands, which is the most common areas, when they go out in the sun, they can burn very easily because there's lack of melanin. And that means that someone cannot play sports for a long time. They can even not do gardening or any sort of other activities outdoors, and they have to cover themselves up. And the second thing is that vitiligo, being an autoimmune condition, is make people be more prone to other autoimmune conditions where your own body can attack not only these cells in your skin, but also other cells and other organs in your body, such as thyroid, for example, even diabetes type 1 and other autoimmune conditions, which can affect the gut.
Are the lesions permanent? So where you've got patches of depigmented skin, is that it? Are you unfortunately going to have that for the rest of your life, or does it come and go?
Normally, it's extremely rare for the patches to repigment, which means bring the color back. So normally you would be with these patches for a very, very long time, and the condition also spread, which means that you will develop other patches too.
And the new treatment that's being announced or has been approved now for use, what is that and how does it work?
The new treatment's called Opzelura, and it's a cream. The active ingredient in it is ruxolitinib, which is what we call a JAK inhibitor. When you apply it on the white patch, can bring the color back in this patch. However, you have to treat your patch with this cream for several months, sometimes over a year, to see good results.
And when you say it brings the colour back, is that because the missing melanin is coming back? It's not just covering it up, it's not just dyeing the skin, it's actually bringing back what you have lost.
Yes, what the cream does, it reduces this inflammatory signal, so it calms down your defense system in that area. This allows melanocytes to literally crawl in from the normal surrounding skin into the white patch and start making the color again. And the way they bring the color back is literally by tiny, tiny little dots, which then join in together. So if you have a large patch, it literally takes months, sometimes a year and a half.
But cosmetically, what does the matured, healed effect look like? Does it look like repigmented, normal, healthy skin again? Or can you still see the patch, but it's not as bad?
Yes, the skin is absolutely normal in color in that area when you have complete repigmentation. Yes. Sometimes the repigmentation is not complete, which means that you can get about 90% of the pigment back and you still have sesamless, like a slightly speckled appearance, but it still looks better than a completely large white patch.
Victoria Eleftheriadou at the British Association of Dermatologists. Some great news for people with vitiligo there. When anatomically modern humans, Homo sapiens, left Africa 60,000 years ago or so, they encountered another human species that was already living outside Africa, which was the Neanderthals. And we now know that the two groups interbred. That's why so many people today from outside the African continent still carry small amounts of Neanderthal DNA on their chromosomes. But there's an exception, because relative to elsewhere in our genomes, the X chromosome contains very little of this Neanderthal DNA. Now, previously, scientists had hypothesized that this is because there's something about the Neanderthal forms of the genes on the X chromosome that made them toxic, so they've been weeded out by evolution. But if Neanderthal and anatomically modern human X chromosomes are so incompatible in this way, you'd surely expect modern human DNA to be correspondingly scarce on Neanderthal X chromosomes too, wouldn't you? Well, it's not. And in fact, as researchers at the University of Pennsylvania have found in a new analysis, it's actually the opposite. It's enriched. So, this leads to a tantalising social explanation for why there is in fact no Neanderthal DNA on our X chromosomes. Neanderthal males may have preferentially been mating, as Daniel Harris suggests, with anatomically modern humans, because males pass on fewer X chromosomes to their children than females do. So over time, a bias like this would emerge naturally.
Hundreds of thousands of years ago, there were multiple different human-like species or subspecies. So we had our species, modern humans, and then we also encountered another one called Neanderthals. And upon encountering Neanderthals, we know fairly well that humans and Neanderthals mated with each other. And so modern humans today, if you have your ancestry coming largely from outside of Africa, then you have about 1 to 3% of your genome actually coming from having a Neanderthal ancestor. So you have actual Neanderthal ancestry. And one of the dynamics that we've wanted to look at is what about ancestry that's gone the other way. So mating between humans and Neanderthals, such that Neanderthals actually have modern human ancestry. And so the main focus on this analysis was looking at how that ancestry is distributed across the Neanderthal genome.
We've actually got the genome for Neanderthals, have we?
Yes, so we have three really high quality Neanderthal genomes. And so high quality meaning this DNA has been isolated from fossils that have been sitting in caves for 50,000 to a little over 100,000 years ago. And so DNA degrades over time. And so some of the fossils we find, that quality, the DNA is very degraded. But then some of the other fossils, the DNA is much better preserved. And so the Neanderthals that we looked at in this study had much better preserved DNA. So we actually have a really good sequence across the majority of their genome.
Which is presumably how we knew that anatomically modern humans like us have got that small percentage of Neanderthal DNA in us. We can see the correlation of the genes from Neanderthals matching up with what's in us.
We can line up effectively the genomes of modern humans and Neanderthals, and we can find there are regions in our genomes that look really, really similar to Neanderthals.
Now, it's relatively easy if we've got a huge pool of anatomically modern humans to look at, and we've got this Neanderthal data to say, well, look, it looks like some of that has come into our gene pool. But how do we know that things have gone back the other way then? How are you able to look at that?
Yes. So one of the ways that we can look at this is the lab that I'm in at the University of Pennsylvania. The leader of our lab, Dr. Sarah Tishkoff, has spent a very long time sampling a very diverse data set of modern humans that come from throughout sub-Saharan Africa. And the reason that that's important to telling this story is that it's thought that most of the Neanderthal ancestry in modern humans, as I've mentioned earlier, are in people who have their recent ancestry from outside of Africa. And so it's generally presumed that most humans, where the majority of their ancestry comes from sub-Saharan Africa, that they don't have actual Neanderthal ancestry.
Because that mixing happened once anatomically modern humans left Africa and met the Neanderthals that were already out of Africa. That's where the mating happened.
Correct. So this would have been the Neanderthal ancestry that modern humans have today, most likely came from that mixing about in the 40 to 50,000 year ago time frame.
How can you use that then to solve this problem of which way the genes have gone and what we've put back into Neanderthals?
What we ended up doing is we took this diverse data set of sub-Saharan African genomes. And what this does is it just searches for regions of modern human genomes that are really similar to Neanderthals. It doesn't tell us why there's a similarity. It just tells us that they are very similar. And so my co-author and I, Dr. Alexander Platt, we developed a methodology that could say, is this region likely coming from Neanderthals flowing into modern human genomes, or is it likely coming from modern human genomes flowing into Neanderthal genomes? And so we were able to differentiate between these two hypotheses with some statistical methodology that we developed.
And does this show that we were adding to the Neanderthal gene pool?
Yes, it does. And it does in a very fascinating way in that it was really old, much older than the Neanderthal ancestry that we have today. And we know this for a couple of reasons. One of them is the Neanderthal that we studied is much older than the Neanderthal ancestry that we have. So it's about 120-ish thousand years old is the fossil. And modern humans got their Neanderthal ancestry, I said, 40 to 50,000 years ago. Another thing that we can do is we can look at the size of the modern human ancestry in Neanderthals. And because of a process over generations, after modern human ancestry goes into Neanderthals, it's going to get broken up over time. And this is, in general, it's a process called recombination. But the most important thing is that these modern human ancestry segments are getting broken up. And we find that they're relatively small in Neanderthals. And we actually date this modern human ancestry in Neanderthals to about 250,000 years ago, which is a really fascinating time in human evolution because it's really early into what we might even be able to call an anatomically modern human.
In other words, the ancestor of both anatomically modern humans and Neanderthals, sometime close to where that split happened, there was still some interbreeding going on, but it was really early, but not
Correct.
Much after that, until the Neanderthals started to put genes into us.
Correct. Yes. So this would be almost a 200,000 year gap between when we introduced modern human ancestry into Neanderthals, or early modern human ancestors introduced ancestry into Neanderthals, compared to when Neanderthals introduced their ancestry into modern humans.
And do we get any clues from this as to which way it was going? Is it males mating with females of one with the other, or was it just a mixture?
The main focus of this current paper is that it was mostly human females and Neanderthal males.
Interesting. And why do you think that might have been the case?
The way that we went about looking at this is our genome has different, we can think of it as having different sets of chromosomes. So there's a set of chromosomes that that both males and females have, and then there are the sex chromosomes, which differ between males and females, where males have an X chromosome and a Y chromosome, and then females have two X chromosomes. And so what we looked at was how much modern human ancestry is found on the Neanderthal X chromosome. And what we found is that there is a lot more modern human ancestry on the X chromosome than everywhere else in their genome. It's about 62% more modern human ancestry, which is a really large enrichment.
It is amazing what we can tell even from all those years ago, isn't it? Daniel Harris there, and that study was just published in Science. That's where we have to leave it for today. Do tune in on Tuesday, though, where for Endometriosis Awareness Month, we're going to be taking a look at a problem that could affect as many as 1 in 10 women. But we'll also be finding out what science is now trying to do about it. Meanwhile, thank you to everybody who's stepping up to support the programme with your donations. It's very generous. It's also incredibly helpful to keep our show on the road, and we really appreciate it. So if you like what we do for you each week and you'd like to show your support, do please head over to nakedscientist.com/donate. And another way to show your support, please do drop us some feedback or some reviews on Apple, on Spotify, wherever you get your podcasts. We welcome that. Until next time, from me, Chris Smith, and the rest of the team here at The Naked Scientist, thank you for listening and see you soon. Goodbye.